Hi students, you are welcome to Angel Health Academy. The topic for the session or topic for the day is strategies of social and behavioral change communication, that is SBCC, social and behavioral change communications. So there are many action plans or measures in social and behavioral change communication. So today we are going to discuss about the different strategies of SBCC. Social and Behavioral Change Communication, SBCC, is a strategic approach. So it has got many action plans, many measures. So it is a strategic approach or method, okay, which is designed or which is intended to influence, to motivate and promote the positive changes. So to motivate and promote the positive changes or positive attitude and positive activities among the individuals, families, communities in relation to their behavior. So positive behavior, positive attitude in health practices for healthy living, okay, positive attitudes, and to have a positive social norms, social activities, socialization. So thus social and behavioral change communication is changing the behavior, okay, changing the attitude and changing the social practices or social norms of the individuals, families and communities. Thus it aims, okay, its main goal, or it aims to improve the health of the individual, family and community, improve the well-being of the individual, family and community, and thus to improve the quality of the life of the people in the community by addressing, by presenting the factors or by changing the factors that drive, that motivate the behavior of the individual, family and community and the social change among the individual, communities and the families. So the ultimate goal of social and behavioral change communication, SBCC, is to improve the health of the people, improve the well-being of the people, and thus to improve the quality of the life of the people and thus protect the people from many diseases and illness and other health related problems. Next is the definition of social and behavioral change communication, SBCC. So as we have already discussed in the previous introduction, it is a strategy, that is nothing but it is an action plan or it is a measures which is used to promote the positive change in individuals' behaviors and social norms, social attitudes, social activities and social practices through communication. So changing the behavior of the people through communication, that is changing the social behavior of the people through communication. Thus SBCC is a strategy used to promote the positive change in individuals' behaviors and social norms through communications. It encompasses a variety of approaches. It includes many components or variety of approaches or methods. So it encompasses a variety of approaches and methods. That are the action plans to influence the people's attitude, to motivate, to change the people's attitude and activities, that is actions, people's attitudes and actions in areas. So in the different areas such as in relation to health, in relation to environment and in relation to various social issues and social problems. So people may have positive attitude, they have healthy practices and actions in related to health, environment and social issues. So the definition is social and behavioral change communication is a strategy used to promote the positive change in the individual's behavior and social norms through communication. It encompasses, it includes a variety of approaches and methods to influence the people or to motivate the people's attitude and actions in areas such as health, environment and social issues. So in these three areas people will use positive attitudes, positive practices and actions. The next definition is social and behavioral change communication, SBCC, involves strategies, that is action plans or measures aimed at influencing, motivating the people's attitude, beliefs and behaviors. So it includes attitude of the people, beliefs of the people and the behavior of the people to improve their health and well-being. So social and behavioral change communication, SBCC, involves many strategies, approaches or methods which is aimed at influencing people's attitude, beliefs and behaviors to improve the health and well-being of those people. So the important session of the day is various strategies, action plans, measures of SBCC. So there are mainly 10 strategies or components of SBCC. So that includes, first one is audience analysis. Audience is nothing but the people, individual, community. Then behavioral insight of the people or community. Then message development for the communication. Cultural sensitivity. Channel selection for passing the communication. Community engagement or participation. Then seventh one is capacity building, strengthening the capacity of the individual. Then implementation and monitoring of the various strategies. Then sustainability and scalability. Scalability is nothing but measuring the strength of these strategies. Sustainability means nothing but continuing. Then use of advanced technologies in SBCC. Use of advanced technologies. So there are 10 important strategies or components. So these are the effective SBCC strategies that is typically included in the following 10 components. Okay. These 10 components can be easily understood by having a small mnemonic. So let us explain the mnemonic for these 10 strategies or components. So I have made a simple mnemonic to remember the 10 components of strategies of the SBCC, that is ABC for misuse. ABC for misuse. So here I have underlined C and I have written 4 in blue ink. That means there are 4 C's. You have to remember there are 4 F-O-U-R, 4 C's in these strategies. So ABC for misuse. So here you have to remember there are 4 C's in these 10 components. So A stands for audience analysis. B stands for behavioral insights. Then first C stands for channel selection. Second C stands for community engagement. Second C stands for community engagement. Third C stands for capacity building. And fourth C stands for cultural sensitivities. Then in the MIS, M stands for message development, I stands for implementation and monitoring, S stands for sustainability and scalability, and use is use only, that is use stands for use of various advanced technology. So in this way you can remember the mnemonic of the strategies of BCC. Okay, this is not the order, but I just made to understand or to remember the 10 components or strategies of BCC. So the mnemonic is ABC for misuse. So now let us discuss in detail about this ABC for misuse or the 10 strategies of the social and behavioral change communication, that is SBCC. So first one is audience analysis. So analyze the audience. Audience are nothing but the individual, family and community. So it includes segmentation, need assessment and barrier identification. Segmentation means we are making all the people into small group. So the grouping, that is subgrouping. The need assessment means, so this BCC we are giving to according the need of the people and according the problem of the people. Okay, that is need assessment. Then barrier identifications. So there are many obstacles or hindrances to have an healthy practices or to follow social and behavioral communication. So that obstacles could find out and that has to be rectified and solved. That is barrier identification. Identification of the barriers of SBCC. So these are the 3 important steps comes under audience analysis. So let us discuss about what is this steps stands for. So the 3 important steps or keys under the audience analysis is segmentation, need assessment and barrier identification. First one is segmentation, that is grouping. So divide the target audience, individual, family and community into subgroups, small groups according to their demography, according to their behavior, according to their needs. The demography means according to their size, then behavior means according to their positive or negative behavior or basic behavior, and according to the needs and problems of this individual, family and community. So first one is segmentation, grouping. Then after segmentation we assess the need of this particular people. So identify the specific needs. Okay, the concerns of the peoples. Then after understanding needs and concerns we motivate. So motivation of each audience segment, that is each subgroup has to be motivated based on their need. So identify the specific needs and concerns of the individual, family and community and motivation of each segment of the subgroups. So the third step is barrier identification. So identification of the certain barriers of SBCC or the problems facing during SBCC or the obstacles. So understand the obstacles or problems or barriers and misconception of the people in relation to participation in SBCC or modification of their behavior or attitude and practice or actions. So understand the obstacles and misconceptions. So misconception nothing but negative thoughts, okay, regarding a particular issue or negative attitude. Misconception that may hinder, that may block or that may restrict the behavioral change of the particular individual, family or community. That is barrier identification. So understand and identify the obstacles and misconception of the individual, family and community that may hinder their behavioral change. Thus modifying that obstacles and misconception them to modify their attitude, behavioral and practice and actions in relation to promote and protect and improve their health and well-being. Second strategy, behavioral insights. So understanding the behavior of the target people or subgroups. So behavioral insight. It includes two steps, behavioral mapping and behavioral change theories. So first, behavioral mapping is nothing but identifying the current or present behavior of the target group or subgroup. Then modifying their behavior, the present behavior by applying certain behavioral theories. That is motivation theory. Okay. So behavioral insight includes two steps, behavioral mapping and behavioral change theories. That is application of behavioral theories. So first one is behavioral mapping. That is analyze the current or present behaviors and identify the various factors that influence the behavior of that subgroup or the individual, family and community. So analyze or find out the current or present behaviors of the people and at the same time identify that factors. So many factors, variables which influence their current behaviors. Okay, so first understanding the subgroups by identification of their present behaviors, their present attitude, okay, present actions in relation to health, environment and social issues. Then second step is behavioral change theories, that is application of behavioral theories. So apply the theories such as health belief model. So it is one of the behavioral theory, that is health belief model, and theory of planned behavior or social cognitive theory. So any theory to modify or motivate the healthy practices, healthy behavior or positive attitude and behavior, okay, has to be applied. So behavioral change theory's application includes apply theories such as health belief model theory, theory of planned behavior or social cognitive theory to understand and predict the behavioral changes of the particular subgroup or the individual, family and community under SBCC. Then third is the message development. Third strategies of SBCC is the message development. It includes three steps. One is clear the message. So make the clear message. Then tailoring the message. And last one is emotional appeal. Give the emotional appeal to the message. That means it includes create. So creation of the messages for the communications. Then customize that particular message. Customize means that make according to the behavior of that particular subgroup. So customize the behavior. Then make it sentimental. So they have to feel the necessity of that changing healthy practice, changing their attitude, behavior and actions. So make it emotional. Okay, give an emotional touch. That is called sentimental. So message development includes three steps: clear message, tailoring the message, and emotional appeal. So giving the emotional appeal to the message. So let us discuss these three steps under message development. So first one is clear message. So that includes create the simple and understandable messages. So the health communication must be always simple and understandable by the audience or subgroups. So create a simple message and that would be understandable and that resonate with the audience. So that should be connected with the problems or specific needs of the particular individual, family or community, and that should be motivate or help to change the behavior of the particular group. So create a simple, understandable message that resonates with the audience. Okay, based on the needs and problems of the audience and according to their level of understanding. Okay, the message has to be created. Second one is tailoring the message. So customize this created message to fit the cultural practice of the individual or subgroup, the social practice of the subgroup, and their personal context, okay, of the subgroup. So customize the message according to the culture of the people, according to the social practice of the people, according to the personal behavior of the people. Okay, so according to their culture, according to their social norms only, they will change. Okay, so our message has to be modified according to the culture of that particular group, or according to the social practice of the social norms of the particular group, and according to the personal values of the particular audience. Then third step is giving emotional appeal to the message. So use different technique or methods in sending the message, like storytelling, okay, testimonials, and emotional triggers, some sentimental feelings, to engage and motivate the individual or family or the community, okay, during the SBCC. So use storytelling, testimonials, and involve or include emotional triggers, okay, to engage and motivate the individuals in the process of SBCC. So message development includes clear messaging, tailoring, and emotional appeal. The fourth strategy of the SBCC is cultural sensitivity. So it includes 2 points. That is, first one is respect for the local norms, that is rules and regulations, local policies of the local people or subgroups. Then second is inclusivity. So inclusivity is nothing but including the vulnerable people and their problems. Okay, so cultural sensitivity includes 2 steps: respect for the local norms of the subgroups or people, and including the need of the vulnerable people, okay, or underprivileged people in the community. So first one is respect for local norms. So ensure that communication strategies or action plans respect and align with the local culture and practice of the people, that is local cultural norms and values, policies, rules and regulation of their village, okay, or their ward. So ensure that communication action plan or strategies respect and align according to that, okay, align with local cultural norms and the values of the subgroups, okay. Then second is inclusivity. So address the needs of the marginalized, underserved poor people, need of the marginalized and vulnerable group within the target population. So in the target population, according to the vulnerability, we make a small group of people, okay, subgroups. So in that, their problems, their needs will be focused. That is, focusing the needs of the marginalized or vulnerable groups within the target population. That is comes under cultural sensitivity strategy. It includes a respect for local norms and inclusivity. Next is channel selections. So this message has to be communicated. For that, we have to select the different channel, okay. So first one is multi-channel approach. So we are not only using one single channel, we use multiple channel, more than one channel. So multi-channel approach, that is called the multi-channel approach. So use of different multi-channels. Second one is channel appropriate, not only collecting different multiple channel, but that should be appropriate. So message has to be communicated appropriately and correctly. So choose the appropriate channels. So use and choose, that comes under channel selection for the BCC. So first one is multi-channel approach. Multi-channel approach. So use a mix of communication channels, not one channel. It is the mixture of a number of communication channels. For example, social media can be used, radio can be used, TV can be used, okay. Other community events, cultural events also can be. During that events also we can communicate our topic, okay, community events, etc., to reach the target audience effectively. Our intention is it has to be effectively to reach the community, family, individual. So multi-channel approach is nothing but use the multiple channels. So use a mix of communication channels such as social media, radio, TV, internet, okay, website, etc., to reach the target audience effectively. Second step is finding out the appropriateness of the channel. So choose channels, select the channels that are most accessible by this particular people subgroup, okay, most accessible, okay, they can avail that particular channel, and trusted, okay. Trusted means it maintains the confidentiality and effectiveness of the message, and trusted by the audience. In such a type of channels only we have to select, okay. That is comes under channel selection. That includes a multi-channel approach and the channel appropriateness. Then sixth strategy is community engagement. So sixth strategy of SBCC is community engagement, that is participation of the community. It includes a participatory approach, that is involve the community in planning and implementation of SBCC, and selection of local leaders or use of local leaders or engage the local leaders and other influence of the particular community or ward in the SBCC. So that includes engage. So community engagement includes or participation includes involvement, engage. So first step is participatory approaches. So involve community members of the subgroups in the planning and implementation of the communication strategies or SBCC strategies implementation. Okay. So involve the community members in the planning and implementation of various communication strategies of SBCC. Then local leaders and influence must be engaged or used, specially used in the SBCC. So engage respected figures. Okay, respected figures means that important people in that particular community, okay, or the ward. So engage the respected figures in the community to advocate for and support the behavioral change. So if the leaders are there, the people will follow that. Okay, for that we have to utilize the respected figures of that particular community to advocate for. So they give the advice to their local people and they support the behavioral change of the particular people in the particular area or community. So thus community engagement includes a participatory approach and engagement of the local leaders and influence of the particular community. Seventh strategy of SBCC is capacity building. So strengthening the capacity of the people. That includes training and resource provision of resource allocations, submission of the or issues of various resources such as man, money, materials. So training and resource provision. So the first step is training. So provide training for health workers, educators and community leaders. So training, that is provide training for local health workers such as health worker, male health worker, female health assistant, male health assistant, female ASHA workers, okay, village health workers or community workers. Then to the educators and local community leaders to effectively communicate the SBCs or the message and support the behavioral changes of the individual community and family. So training program for the local health workers, educators and community leaders for the effective implementation of the SBCC. Second step is resource provisions. That means allocation of the various resources needed for SBCC. So ensure that resources are available and materials are available in hand to support the communication efforts or SBCC. So resource provision is nothing but ensuring or making sure that the resources, man, money, materials are available in hand for the successive implementation of the SBCC. That will support the communication efforts in SBCC. So capacity building including the strengthening of the SBCC through training and resource allocation and provisions. Eighth strategy is implementation and monitoring of the SBCC programs. So implementation and monitoring. It includes pilot testing, monitoring and evaluation and feedback mechanism. So first one is pilot testing. Small group we will take and we will test the effectiveness and we will modify according to that result of the test. Then continuous monitoring and evaluation. So continuous assessment of the effectiveness of the SBCC. So throughout or periodically and continuously. Then feedback mechanism. So collect the feedback from the public towards the effectiveness, that is both positive and negative effect of the particular SBCC, and if necessary modify. Okay, feedback is necessary for the modifications. So implementation and monitoring includes three steps: pilot testing, monitoring and evaluation, and feedback mechanism. That is discussed in detail. First one is pilot testing. So test message and strategies on a small scale for a small group of people before wider implementations. Okay. So test messages and strategies, measures or action plans on a small scale basis before the wider implementation for the large group or large scale basis or on large scale. Okay. Then monitoring and evaluation. Continuously assess the effectiveness of the SBCC. So continuously assess the effectiveness of the communication effort and make necessary adjustment or modification if necessary. Okay. The last one is feedback mechanism. So create the different channel for feedback to collect the or receive the information from the public for the individual, community or family. So create channels for receiving and addressing. So giving communication feedback, okay, or response or reply, and addressing the feedback from the audience. So feedback will collect from the audience and will give the reply to the audience. For that we have to create the channels. So SBCC has to create the different channels for the collecting feedback and replying for the modifications or response to the public in the modification process of the SBCC. So implementation and monitoring strategy includes a 3-step pilot testing, monitoring and evaluation and feedback mechanism. The 9th strategy of the SBCC is sustainability and scalability. Sustainability nothing but continuing the process, continuity, okay, for a large scale. Scalability is the measuring the ability of the SBCC, that is the strength of the SBCC. It includes 2 steps, integration and partnership. Integration and partnership. Integration is nothing but incorporation with the different programs, incorporate or incorporations. Partnership means collaborate with the other agencies, other groups, okay, for the successive implementation of the SBCC. So first is integration. Incorporate SBCC strategies, action plans or measures into broader health programs. So we have many health programs. In all the health programs we have to incorporate the SBCC. And we have many policies, health policies. In that also we have to incorporate. That is integration called. So integration is nothing but incorporate SBCC strategies into broader form in the different health programs, national health programs and different national health policies. Second step is partnership, making collaboration or cooperation with the other agencies for the successive implementation of the SBCC. So collaborate with the government agencies, then non-government agencies, other health related agencies, government agencies and non-government agencies and other stakeholders. That they are nothing but the owners of the health sectors, health agencies, hospitals, medical college, etc. So stakeholders to ensure the long-term support and resources for the successful completion of the or implementation of the SBCC. So partnership includes collaborate with the government agencies, non-government agencies and other stakeholders to ensure long-term support and resources for the SBCC. Okay. The last one is use of advanced technology in SBCC. So use of technology includes 2 steps, digital platforms. So finding out various advanced digital platforms. So that is advanced technology, using advanced technology in sending the messages and receiving the feedback. Then data analytics. So using the software to analyze the data which is received to find out the success of the SBCC. Okay. So use of technology includes 2 steps, digital platforms and data analytics. So first one is digital platforms. So leverage mobile apps. So there are many mobile apps are there. Mobile apps are available at present. So that can be new mobile apps can be developed for this purpose, SBCC. So leverage the mobile apps, website, create the websites, okay, specific websites and use the social medias like Facebook, Twitter, Telegram, etc. So use the social media for reaching the wider audience. So we can cover a large population, wider audience and thus providing an interactive content. We can provide the interactive content to the large group, okay, through digital platforms. Then second step is data analytics. Utilize the data analytics software or system to track the audience engagement and effectiveness of the communication effort. So this effectiveness we can track with the utilizing various analytics. Okay, so utilize the or use the different data analytics or software to track the audience engagement, audience participation, to understand the audience participation and for the effectiveness of the communications. Okay, so these are the 2 steps comes under use of technology. So far we have discussed the 10 different strategies or action plans or measures of the SBCC. So let us conclude the topic. Today we have discussed about the SBCC strategies. There are 10 important strategies and sub actions. That is audience analysis. First strategy includes segmentation, need assessment and barrier identification. Second is behavioral insights, that included behavioral mapping and behavioral change theories, application of behavioral change theories. Okay. Then third one is message development, that included clear messaging, tailoring and emotional appeal to the message. Fourth one is cultural sensitivity. It includes respect for the local norms of the people and inclusivity. Then fifth one is channel selection, that is use the multi-channel approach and use the appropriate channel. Sixth one is community engagement, which includes participatory approaches and local leaders and influencer engagement. Then seventh one is capacity building. It includes training and resource provisions. Eighth one is implementation and monitoring. It includes pilot testing, monitoring and evaluation and feedback mechanism. Ninth one is sustainability and scalability. It includes integration and partnership. And last 10th one is use of technology, which includes digital platform and data analysis. So in short, all these 10 strategies, SBCC strategies, when effectively implemented. So if it is implemented effectively, it can lead to a meaningful change in the attitude, behavior and actions or activities of the healthy practices of the people that contribute to the better health outcomes and overall community and family well-being in the nation. So far we have discussed about the important strategies of SBCC. Hope this video really benefits in your studies and exam. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next important educational video. Thank you.